I really don't want to look fake or done. Can I still get natural looking results?
Absolutely. Very possible. Usually when we talk about looking fake or done, it refers to face procedures. And so it's something super important we talk about all the time. But with respect to breast and body, it typically refers more to the breast. And I think refers to is whether or not we're doing a proportional type implant. And so there are ways of making breasts look natural, and there's ways of making them look unnatural. For me, I think we need to put the implant under the muscle. That gives you the maximum amount of coverage over the muscle, and it helps disguise the implant and doesn't have that sort of stuck on look that I'm really not a big fan of when you put it on top of the muscle. Next, and super important, is what is the shape of the implant we put in and its relationship to the chest wall. So you can look at the chest wall or the hemi-chest wall, which is one side, and you look where the muscles start on the sternum and ribs, and then where the outside of the body is. And so the muscles can start kind of far apart or close together. And so we can really see that during your exam and know about how wide you are. So when I'm doing a consultation with someone, we'll look at some pictures and pick a proportion. And then I'll match that implant, that proportion, to the size for their body. So each one is customized for each particular patient. One thing you don't want to know is all your friends' sizes or look at numbers on the internet, because we're going to customize it for you and your body, and it will be different for someone who has a different size or shape body. And so that's really key, is like we try to delete all that information of numbers and things and go by what you look like to help pick the right implant size. Once we pick the right size, we'll pick a profile of implant that will match up with your chest wall. And so you want that to go right from those muscles to the side of your body. If it's too wide, then it will stick out the side, kind of get in the way of your arm, and look more unnatural. And so that is what an unnatural breast augment would look like. But that can also occur if the implant's too small or too narrow. And so the implants naturally sit down and out, so in the bottom corners of your chest, and they'll go upwards the diameter of the implant. So as you reduce the diameter of the implant, because they're sitting out wide, the cleavage will just get wider and wider. So you want to have an implant that spans from the side all the way towards the middle. And if you match that up, it looks very natural. If you're too small, the cleavage will look really wide. And if you're too big, it'll stick out the sides. And so, yes, there are ways of making them look natural. And that's one of the things we talk about during the consultation.